Hey everybody, glad you could make it here today. What I actually wanted to share with you is a real case study from a client in my practice that of course is anonymized. I just labeled this as blood pressure case study or BP case study. Now I'm going to give you their actual protocol. I don't want you to copy this just for you, but I want to share with you what a true functional medicine integrative health protocol looks like that I've used many times in the past. Now, I will let you know this is based on this person's individual needs after running the big 5 labs, but also people could just run what's called the vitamin tox test or the starter kit to get their vitamin and mineral levels, etc. So let's dive right into it. So whenever I meet with a client, I like to give them a cutout of what they're going to put in something that looks like this, their nutritional supplement vitamin box. And they literally cut around the gray line and they tape it inside of the box. And you can see my vitamins are all in here. These are my lunch ones. And then I have my breakfast and my dinner. So I'm going to go over those in a moment, but I like to add lifestyle factors. Now, sometimes I get very in-depth and I will share with the clients biofeedback. I'll share with them specific types of neurofeedback, different modalities that I'll use. But this client was about 70 years old, and what I wanted to do was give them just the basics, just the foundation that I know will get them the results they're looking for in about 8 to 12 weeks time. And then we'll go over this high potassium food list at the end. All right. So A to Z, let's dive right into it. It's not going over sleep. It's not going over a lot of that. It is just straight to the point. So like I said, this is the nuts and bolts of a good, healthy blood pressure protocol. Not everything you can do, but exactly what this client needed. All right. So first thing upon waking, they're going to be taking alkalizing vitamin C, a half to 1 scoop a day. Now, this is a buffered vitamin C. So if they have acid reflux or they have any issues, they're going to consume that with warm water or room temperature water. They're also using this product because they are someone with more constipation. And if they have constipation, I'm always using the alkalizing vitamin C in the morning, and I'm using the full spectrum magnesium in the evening, specifically the calming magnesium, which is a half a scoop to 1 scoop before bed. So this individual, when they ran their minerals and metals test, showed high levels of calcium and lower levels of magnesium. One of the reasons why, by the way, they have high blood pressure. Now, I can't go into it today. I have previous podcasts on it, but people only have high blood pressure for about 6 main reasons. And if we figure out which one of the 6 reasons it is, we can easily push down on the antagonist lever to be able to relax the blood vessels. So it could be fibrin overgrowth or buildup in the body. It could be, which is, by the way, if I saw that, I would add a product called proteolytic enzymes. It would be my number one thing to do if I saw that was the reason why this individual had high blood pressure. I'd be taking 2 proteolytic enzymes upon waking, and I'd be taking 2 before bed. But anyway, that's a different story. And so this individual, we saw that it was really an imbalance with lower levels of potassium, lower levels of magnesium. And oftentimes when it's high cortisol, we're waiting for that lab to come back. I'll use Adrenal Soothe. And Adrenal Soothe actually lowers cortisol levels. And so we do that before bed. Okay, so top to bottom, this person's taking alkalizing vitamin C and water upon waking, and they would take that with the proteolytic enzymes. Then they're using daily nutritional support. That's a shake. I'm having them do a lot of fluid. This person needs more hydration. Anybody with high blood pressure most likely is dehydrated. That's like first and foremost. So they're taking in about 12 ounces of water here to 16 ounces, which is good to take fluid upon waking. And then they're taking 20 ounces with their daily nutritional support, and they're going to be mixing that with a cup of like wild blueberries. They can just blend it up, or they can have it on the side. So easy. That gives them all their methylated B vitamins. It gives them their vitamin K2 and much more. So really great product. It even gets in some flax and psyllium and some other great things, which they're going to be taking as well. So you can see right below, they're taking psyllium husk with their shake, 1 level teaspoon. That's going to get them about 5 to 6 grams of additional fiber. One of the great things for blood pressure is fiber, specifically psyllium husk. All right, I'll go into that in lifestyle in just a second. Daily fruit and vegetable blend, 22 organic fruits and veggies. It's going to help with potassium. It's going to give them a lot more antioxidants. Vitamin D3 and K2, that's 4,000 IUs of vitamin D3. They're getting sun actually all year round, but it's not converting as well. We're going to add a little bit more K2 on top of their DNS. They're using 1 teaspoon of cacao powder. Cacao powder, believe it or not, we're talking about 100%. We're not talking about we're not talking about like Nestle Quick here. We're talking about 100% cacao, bitter chocolate powder. And that is a very powerful vasodilator and helps with nitric oxide production. If I believe nitric oxide production was the issue, I would add more beets to their diet, or even a shot of beet juice that they held in their mouth for about 30 seconds and then swallowed so that they can help the capillaries in the mouth produce more nitric oxide. All right. So cacao powder, you just mix all these in the shake. Like that's easy. 4 drops of vitamin D3, you put it under the tongue, swallow it down with your first sip of the shake. Easy. All right. Then we're moving over to lunch or dinner. I want them to do 3 grams of omega-3s per day. I really want to push down their omega-6 levels. They were 13-1 from omega-6s to omega-3s. You should be at 3-1. So way too much inflammation in their body from omega-6s. So again, if you want to run that lab, we'll link it up for you here today. But all the labs, honestly, all the labs are just at stephencabral.com/shop. That's where all these products are. That's where everything is. You don't have to use what we use in our practice, but I've gotten a lot of requests for this, so I wanted to make this readily available, and then you can choose what works best for you. All right, Hispro, that contains quercetin, more vitamin C, so they're getting more vitamin C at the end of the day, and stinging nettles, a lot of great things for overall histamine production and cytokines. And then we've got magnesium. That's going to kind of calm the sympathetic nervous system and really relax the parasympathetic nervous system so the vascular system can dilate and relax so the blood can flow properly. All right, it's also going to help with blood sugar and more liquid melatonin so that we get into a deeper, more restorative sleep. And melatonin, most people don't know this, but is a very powerful antioxidant, anti-cancer. But again, can't provide medical advice, medical treatments, medical cures, medical diagnosis. Before bed, I've got another powder in here called Calming Magnesium. They can take that with anything they need to before bed, but it looks like that's it. And then a Zico coconut water, 1 per day. Why Zico coconut water? I don't own any stock in the company, but it is the highest potassium per ounce coconut water. So Zico coconut water has about 1,000 milligrams, almost a full gram, 1,000 milligrams of potassium per, it's about 14-ounce bottle. So there you have it. And then 1 avocado a day. I literally put in coconut water and avocado as supplements. They need to take these 1 a day. Why? Because when you combine these two, you get almost 2 grams of potassium a day. And I want them to get 4 to 5 grams per day of potassium to, again, help dilate the imbalance that many people have with high blood pressure. Remember, when you have high blood pressure, you're often sympathetic nervous system dominant. What pushes the parasympathetic, which is the rest of relaxed? Potassium. What calms the sympathetic nervous system? Magnesium. Don't overdo it, but you do want to be able to create that balance. All right. So the most important notes I gave this individual for the first 12 weeks, again, I don't want to overwhelm anybody. So this is exactly what I give them. And I say, listen, we're going to check in each week. We're going to do a check-in, but then once a month, we'll do a call as well, and we'll make adjustments to your plan. So if I feel like blood pressure may take 6 to 8 weeks to start to move down, but they're testing it every morning upon waking, and they're testing it before bed. So anyway, that's that. So we can actually start to see it move, and we'll make adjustments if needed. So if I don't see what I want after 4 weeks, sure, I'll add in the proteolytic enzymes. I'll add a little bit more. I'll add in some beets, but not yet, because I don't want to do more than I have to do, right? All right. So what else did I tell this individual? Yes, high potassium foods. I give the list below. Really simple to follow. Now, I want you to add in 10,000 steps per day. Walking after a meal for 20 to 30 minutes is the gold standard if you can do that. If not, just get me 10,000 steps a day. All right. Work up to it if you need to, but I want you moving your body, and I want you moving, believe it or not, with blood pressure, you need to move the blood from the calves, the gastrocnemius back up to the heart. A lot of people with high blood pressure aren't doing that. If you can't walk, do foot pumps. Sit in a chair, pump your feet back and forth, back and forth. Dorsa and plantar flexion, it's called. All right. Take your blood pressure every AM and before bed and write your numbers in a journal, and then they're going to send them over to me. The supplements in gray should be added only if needed for BP. So if I get his stress, mood, and metabolism test back and he has high cortisol levels, we're going to add Adrenal Soothe. So I just put in there for right now. Gray means do not use. Orange means optional. All right. So, number 5, stop eating by 6 p.m. every night. Ideally 5, but stop eating by 6 every night. No food until 8. That gets you 14 hours of an intermittent fasting window. Number 6, retest labs if needed after 8 to 12 weeks, but I'm checking in with them once a month, so we can retest only if needed. Number 7, sauna. Now, I said the minimum for this individual when I was talking with them is 3 to 5 times a week for 20 to 30 minutes. That's the minimum. Now, keep in mind, they're 70 years old. They're not 35, right? So I want to be slightly careful. If it was 35-year-old with high blood pressure, they're probably able to do sauna 6-7 days a week at 30 to 30 plus minutes. But this individual is 70, which is why everything is bio-individualized for the person. But do I want to work them up to 5 times a week at 30 minutes? I absolutely do. All right. I talked about the Zico water and the avocado a day, 2,000 milligrams of potassium. And I said, you don't need to, though, stay away from a real sea salt, a real Himalayan sea salt, like from India, or a real salt from the salt beds of Utah, or a Celtic salt, right? All of those are okay with me. If they start to feel lightheaded or dizzy, they may need to bring up a little bit of sodium. Not overdo it, all right? But they can do that. Add biofeedback, resonance breathing to immediately bring down blood pressure if needed. So if their blood pressure is above 140, I want them to literally use the HRV app that I've recommended before, and just open up an app and it says biofeedback or resonance breathing. You watch the circle expand, you breathe in. As the circle collapses, you breathe out. And you just follow that for 3 minutes. That will immediately bring down most people's blood pressure. All right. And then complete the 21-day detox to begin everything as fast as humanly possible. If not today, yesterday would have been better, but tomorrow's okay. 21-day Equal Life Functional Medicine Detox, highest recommendation right away. Add your Zico water, add your avocado, but do that 21-day detox right away. All right. So now let me give you the exact food list that I gave this individual. I'm giving you literally the outline that they print out. It's only 2 pages. They've got their supplement label. They've got their top tips. They cut out their supplement label. I make it really easy, straightforward. And then here's their food list. I'm not overly concerned about some of the other things that they're eating. Yes, I want them to get in good quality, high omega-3 fish a few times a week. I want them to do, but really I'm crowding out a lot of the other foods because I'm doing blueberries with their shake in the morning. And I'm asking them to get 4,000 milligrams a day. I wrote everything in. They can see how much it is, right? An avocado for just a half is 690 milligrams. Now, again, it depends on obviously the size of the milligrams, but you don't have to get that wild about this. It's somewhere around 1,200 to 1,400 milligrams of potassium. Great. So 1 avocado a day, easy way to get potassium, great fiber, great healthy fats. Do it at dinner if you want, maybe a little less starches. You're going to be good to go. All right. Pomegranate, 660 milligrams per pomegranate, per fruit. Amazing. If you get the peeled ones, you'll do like half a container. Pomegranates, lots of fiber, low glycemic, high antioxidants. Amazing, right? Sweet potatoes. If you're going to choose a starch, those are the ones to go with. I recommend them over the white potatoes for this individual. That's why I bolded them. Swiss chard. Look at that. If you're going to choose a green veggie, choose Swiss chard. Saute that. You don't need to saute it in oil. Saute it in a little water. It's going to be amazing. Then you can add your olive oil afterwards when you serve it. All right. There's the beets again. Big fan of the beets. I just didn't add it for this individual right now, but it could be one that I definitely add. Obviously, broccoli I'm a big fan of. I just said, listen, if you're just looking for biggest bang for your buck, my goal is to get people the results they want as fast as humanly possible, but safely. And then after that, of course, we can open it up. We can do whatever. But they know they can eat broccoli, they can eat multiple veggies, but if they can, add in Swiss chard a couple times a week, maybe once a day. All right, next up, what can they do for plant protein maybe at lunch, and then at dinner they do some fish, they do some meat, they do whatever. Okay, look at the potassium in all of these different beans, right? Lentils, white beans, and that counts for cannellini beans, chickpeas even. It's great. That's a cup. Like cup's a great amount. Right? That's going to count for their protein and their carbs at lunch. Now they just need to mix it with veggies. Amazing. So they've got everything they need there. Almonds, nuts, and seeds. I said, don't overdo these. You don't need as much of the almonds, nuts, and seeds right now. We're getting you the fiber from other things. There's more polyphenols in the brightly colored veggies in the fruit that we're giving you. If you're going to do any, add a little bit of pumpkin seeds. Nice for zinc, good nutrition in there, good for prostate. So that's that. Dairy and protein, turkey and salmon are my wild salmon and pastured turkey are my picks for this individual. A little higher in potassium. We don't need to go overboard with potassium. They can eat other foods as well. But again, if we're trying to move towards that, Why not, right? And then if they need to do a little bit of a grain, quinoa is the clear winner when it comes to potassium levels. And again, keep in mind, most people are lower in potassium, higher in sodium. So that's why doctors tell you to stay away from salt, stay away from sodium. Yes, some people are more genetically predisposed to retaining more water and increasing blood pressure based on sodium. There are actually genetic SNP, single nucleotide polymorphisms, that cause that. But truthfully, it's not really that people are eating an unhealthy level of salt, unless of course they're eating fast food. The real issue is they're not balancing it with potassium, because sodium should maybe be 1,200 to 2,000 milligrams per day, but potassium is meant to be 2 to 3 times sodium. And so the problem is people are just not getting in their potassium per day. So hopefully this was helpful. It's a little taste of what we do working with clients, my team and I. These are the nutritional supplements. It's not really going overboard. There's literally only 3 different capsules to swallow. All of these are liquid. Most of them are mixed in a shake. It's really easy for clients to follow. And we start with a little bit of less. Now you might say this doesn't look like less, but truthfully, this isn't that much. And when you do this, you then return the body back to a state of homeostasis, equilibrium, where it's then balanced. And once that BP comes down within 12 weeks, then we stay on this for another 4 to 8 weeks to make sure we've got it, that it's locked in place. And then we begin to wean off some of these that they might be looking to come off. Not totally come off, but we could come off something like Hispro. We could wean down a little bit on the vitamin C, and we'll keep in some of the magnesium. So like, we're not going to totally eradicate these because it's what's keeping someone balanced, but we can certainly reduce a lot of these, like even cacao powder if they didn't want to do that. So hopefully this was helpful. I could go on and talk about this for hours, but I'm telling you, this works. This is true integrative health, running functional medicine lab testing, finding out exactly what your deficiencies are and your toxicities, replacing the deficiencies, removing the toxicities, restoring the body back to a state of balance. Of course, if this was helpful, do feel free to share it with anyone else you feel it could serve. All of the products, all of the labs are at stevencabral.com/shop. That'll take you over to EqualLife. And then for the show notes from today's show, head on over to stevencabral.com/3322. Take care, everybody. Have an amazing day. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything. Functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.